Alrighty, we're going to get started here in just a minute. We're going to be talking today about Medicare supplements versus Medicare Advantage. And we will be deciding or discussing about what would be a better choice for you. But just give me 1 sec, I'm still just finishing getting set up. Alrighty, let's go ahead and get started. If you are watching this as a rerun, feel free to, jump ahead a few seconds. And we will be getting into the meat of things. Alrighty, my name is David Walls. I am with Florida Medicare Broker. We are an assurance broker located here in the state of Florida on the Nature Coast. We serve the entire state, all the way from Dade County up north to Duval County, and all the way west to Pensacola. And we even also serve the entire state of Georgia now. But we're going to go ahead and talk about Medicare supplements and Medicare Advantage today. The single most common question that we get, and I get this from literally everybody I meet that is interested about Medicare, from customers to even family members and friends, people I go to church with, everybody I meet. And the question is, what is better, Medicare supplements or Medicare Advantage? And if you look at YouTube videos or news articles about Medicare, it seems like everybody wants to point the direction at one plan or the other. And the truth is this: there is no blanket answer. And it's simply because everyone's needs are different. Different plans are designed to meet different needs. It doesn't matter if your brother has a certain plan or your wife has a different plan. Two brothers might have completely different needs. Even a husband and wife could have drastically different needs. Their health may not be super great. They might have one foot on a banana peel and the other one in the grave. And the other could be super healthy, not taking a single prescription. Happens all the time. And those two people are going to have different healthcare needs. So please disregard all the noise that you hear in commercials and online about this being specifically the best plan out there. Because it might be for some people, but maybe not for 90% of the people out there. So if you're looking for just one quick answer today on saying Medigap is definitely the best plan out there, or Medicare Advantage is always the best, I'm sorry, but you came to the wrong place. You might want to click away to something else. But if you actually want to take the time to kind of look at why this might be the better plan for you, or that might be the better direction for you to go ahead and buckle in, because we're going to have a lot of fun. So let's talk about Medicare supplements first. The pros of Medicare supplements. Then we're going to talk about the cons after this. But the things that are definitely in the pro column for Medicare supplements. First, I want to touch base on Medicare supplements, also known as Medigap plans. So you might have heard the term Medigap as well as Medicare supplement. Know that it's exactly the same thing. It's literally the same thing. It goes by two different names. I am 100% convinced it's simply just to make things a little bit more confusing. I've been in this business for over a decade now, and I cannot come up with any other reason that it would have more than one name except just to make it a little bit more confusing. But in the pro column, the first thing is that it offers peace of mind with a predictable monthly premium. If you're the type of person that wants to know that generally your cost is going to be this amount every single month, and that's something that you truly appreciate, then a Medicare supplement definitely checks that box in a big way. Because your monthly premium is going to be that month after month after month. Now, it does go up a little bit with inflation, you know. You can expect a Medicare supplement premium to go 3 to 5% per year up on average. But, January, February, March, July, August, so on, your cost is going to be right there. And you know how much you can budget pretty easily for a Medigap plan. Then on top of that, when you use the plan, there's going to be little to no out-of-pocket cost. Now, if you're a little bit older, you started Medicare before the year 2020, you had the option of a Plan F. It's F as in Foxtrot. You have no out-of-pocket costs when you use it. But for those who started Medicare in the year 2020 and after, there is a Plan G. That's G as in golf. And you have a little $240 deductible. Not a bad deductible, I'm just saying. That's, for most people, very manageable deductible. But you're going to have very little out-of-pocket cost. After you meet that deductible, you're going to have no more out-of-pocket cost. And a lot of people can appreciate that. It's definitely a big check in the pro column. The next thing is essentially no networks. You have the ability to go to any doctor, any hospital, anywhere in the USA that accepts Medicare. Nationwide, we're talking roughly 95% of all doctors and all hospitals in the United States. And that's a big green check in the pro column for Medicare supplements. That means you can go to Mayo Clinic in Jacksonville. You can go to MD Anderson in Texas. You can go to pretty much any hospital, any doctor, anywhere in the country. You don't have a limit of your insurance company saying, no, you can't go to this doctor. No, you have to go to that doctor. You don't have to have a primary care physician. If your primary care physician you feel like is starting to slack off and not do their job very properly, then you just say you're fired and you go down the street to another primary care physician. It's a beautiful thing. Then on top of that, you don't have to get referrals. That's a big plus for Medicare supplements. If you feel like you need to see a cardiologist or a dermatologist or a fill-in-the-blankologist, anything that ends in ologist, then you go. You got something growing on your arm, you go see that dermatologist. You don't have to ask for referrals with a Medicare supplement, and that's a beautiful thing. And then probably the biggest plus that's somewhat overlooked is prior authorizations is practically non-existent with original Medicare. That means you don't have to worry about an insurance company denying a procedure or saying, no, we're not going to pay for that. It's pretty much non-existent. And that's the most beautiful thing about Medicare supplements. You don't have to worry about, is this going to be approved by my insurance company when you have cancer? You don't have to worry about the insurance company saying, maybe we should try this first before you get that brain surgery. You don't have to worry about any of that. The peace of mind offered by prior authorizations being almost non-existent is probably the biggest green check in the pro column for Medicare supplements. If you've ever had insurance before and you've had a procedure denied, you realize just how big of a deal that actually is. And in fact, I kind of wish I put that one in bold, that bullet point. I kind of wish I put that one in bold and made it a little bit bigger, because that deserves 2 green checks in the pro column just for that one bullet point. Now you might be asking, who is Medicare supplements best for? People that don't want to have to worry about networks. If you're the type of person that just says, I want the ability to go to Mayo Clinic, I want the ability to go to MD Anderson in Texas, or see a certain doctor I know of in the upper part of Michigan, or a certain hospital in New York City. If that is you, or if maybe you're even the type of person that is living in an RV and traveling around the United States for 9 or 10 months out of the year, and you don't want to have to worry about an HMO or PPO network when you're 1 week in the Grand Canyon and the next week in Omaha, Nebraska, and a week after that in Milwaukee, Wisconsin. A Medicare supplement would be up your alley then, absolutely. If you don't want to have to worry about networks, or if you have 7 or 8 doctors that you are married to and you say, I love these doctors that keeping me alive, I don't want to have to worry about PPO networks or HMO networks, Medicare supplements are definitely for you. If you appreciate the peace of mind of having little to no out-of-pocket costs when using the plan, a Medicare supplement might be a good choice for you. Those are the big things. If you're looking at your Medicare insurance and you're wondering, should I go with a Medicare supplement? If any of this is like, wow, this is number 1, maybe number 2 priority for me, any of the stuff we discussed on this screen, then I would say absolutely, Medicare supplement, you might be leaning that way. Okay, so everything in life has a downside. Anybody who says that there are no downsides to a Medicare supplement is lying. The biggest downside is the monthly premium. Now, in the state of Florida, those monthly premiums can often be right in a ballpark of $200 a month. Sometimes even more, depending on what part of the state you're in. And let's be honest, that could be a burden for a lot of people. You know, if you have a social security check and you're getting, say, $1,200 a month, $1,400 a month, that $200 a month just for the supplement, on top of the Part B premium, on top of a Part D, as in Delta, your drug plan premium, that can add up very, very quickly. You know, you have the Part B, as in Beta premium, you have your supplement premium, and then you have your prescription drug plan premium. You add that all together, and you're suddenly looking at like $400 per person. Maybe a little less, maybe closer to $350, depending on the part of the state you're living in. That can add up pretty quickly. You have a husband and a wife, you're looking $700, $800 a month. That's a pretty big downside. That's a reality for a lot of people. You know, if you have $2,000 a month coming in, maybe $2,500, give or take a few hundred in each direction, and you have a husband and wife, suddenly you're looking at $700, $800 a month. You know, you're talking 40% of your income. So that's a downside. On top of that, a supplement by itself only covers the medical costs. It does not include prescription drug coverage. So you're going to have to buy a drug plan on top of that. And then if you want dental, vision, and hearing coverage, you know, anything extra above and beyond what Medicare covers, that's another monthly premium. So that's a reality for a lot of people. And that might be a downside for certain people. Some people, they say, if you look at this and you're saying that's not an issue, I can comfortably afford that, then maybe Medicare supplement is right for you. But if you're looking at that and you're saying that and you're cringing, let's talk about Medicare Advantage. The pros of Medicare Advantage is, here in the state of Florida, they typically have no monthly premium in addition to the Part B premium. Some plans even refund a portion of that Part B premium, making it even more affordable on a monthly basis. But no monthly premium, that means right off the bat you're talking $2,000 plus per year in savings. That's a lot. Now, this coverage, Medicare Advantage plans, it often includes coverage above and beyond that of which original Medicare, even with a Medicare supplement, has, such as dental, vision, and hearing. So you don't have to worry about buying an additional policy for dental coverage. You don't have to buy an additional policy for vision. You don't have to buy an additional policy to cover hearing aids. It's all included right there in that plan. Same thing with prescriptions, included at no additional cost. Whereas a Medicare supplement, you had to buy that additional policy, often for $15, $20, $25 a month. Probably even more going into 2025. There's some major changes coming to Medicare in 2025. Make sure you reach out to us this fall and you review your drug plans. Seriously. Big changes come in 2025. We're going to have some videos coming up that we're going to put on YouTube and Rumble for those 2025 changes over the next couple of weeks. Now, these Medicare Advantage plans, they do have some out-of-pocket costs, but often the out-of-pocket costs, the maximum out-of-pockets are usually lower than the annual premium of a Medicare supplement. It's not uncommon for the MOOP, as we call it in the industry, which stands for maximum out-of-pocket. being lower than the annual premium of a Medicare supplement plan. That's not uncommon. In fact, that happens a lot. But when you use the plan, often $0 copays when you see a primary care doctor. 25, maybe $35 copay for a specialist. It's not a lot out of pocket. And even the prescription drug coverage, Tier 1 is often the $0 copay. Tier 2, not uncommon to be a $0 copay. Tier 3, maybe $35, Varies by plan and by county. So who might these plans, these Medicare Advantage plans, be best for? People that desire coverage above and beyond what original Medicare offers, even with a supplement. If you want that dental vision, if you want that dental coverage, that vision coverage, hearing coverage, if you want some of those extra benefits that Joe Namath talks about in those commercials, this might be the right plan for you. If you don't want to have to be paying, $200, $300 a month for insurance coverage, if you want something that's a little bit more budget friendly, this might be the right direction for you to go. If you're cringing when we're talking about Medicare supplements, this might be the right avenue for you. If you're not cringing right now, if you're looking at this and you're listening to this and you're saying that sounds like a good idea, this might be the right direction for you to go. But there are downsides. Anybody that says Medicare Advantage is 100% the right plan for everybody is lying. Everything in life has a downside. The biggest thing with Medicare Advantage is the networks. Medicare supplements are great. You can go to any doctor, any hospital, anywhere in the country that accepts Medicare. Medicare Advantage has networks. Now, granted, PPOs have a much broader network. And if you go with one of the big names, like Humana or United Healthcare, for example, they have nationwide networks. Aetna, same thing. But HMOs typically, they're concentrated, maybe statewide. Typically, not always. Some of the smaller companies with the funny names, they're only in like 14, 15 counties in the state of Florida. So, going to Mayo Clinic may not be an option. And some of the plans, specifically HMOs, they require referrals. Now, PPOs, granted, they don't have referrals, and you can go outside the network with a PPO in most cases. You might have a little bit more out of pocket when you use it outside the network with a PPO, but you have that option. But HMOs, that's not the option. In fact, HMOs, you have to go see your primary care doctor and get a referral to see a specialist. And that could be a pain in the neck for some people. But it is a reality with HMOs. And then, of course, these plans do have prior authorizations. HMOs more often than PPOs, simply by the nature of the plan. HMOs typically 2 to 3 times as many prior authorizations as compared to a PPO. But prior authorizations, they do happen. It is a possibility that you might get denied coverage for that knee replacement. They might tell you they want you to try something else before you try a certain procedure for another condition. So that is something right there, and that could be a big red check in the con column for Medicare Advantage for a lot of people. And there is a lot of horror stories on the internet. Some of them taken, out of context and exaggerated a little bit, but some of them there's a certain amount of truth behind it too. So if this is something that, if you look at these 3 bullet points right now and you're saying those are really important to me, the networks and prior authorizations, then maybe Medicare Advantage is not the right product for you. Maybe you should take a second look at Medicare supplements. So you have to make sure, you look at your own situation, decide what your risk tolerance is, have that conversation with your broker, hopefully us, and, decide what is the right route for you to go. Keep in mind, you're never locked in a plan for life. You can, there is open enrollment. You can change from time to time. So take some heat off yourself. You're not going to be in any plan for the next 35, 40, 50 years or however long it is. You can change from time to time. I want to take some of that heat off of you. There's a lot of people online that like to scare people and imply that they are in a plan for the rest of their life, and that's simply not the case. But we are a Florida Medicare broker. Give us a call. If you have some questions about your Medicare coverage, if you're turning 65 or you just moved to Florida, or you want to change plans at some point, give us a call. Let's have a conversation. Let's talk about let's talk about your coverage and what's important to you. I do thank you all for your time. Our website is in the description box below. Visit our website, DEW as in Delta Echo Whiskey Insurance.com. Give us a call, shoot us an email. Let us know what you think if you have any questions about your coverage. Thanks, y'all. Appreciate your time. Take care.